Basically, for our medical students that apply here, either through a clerkship or through a sub-I, really get to experience the full breadth of family medicine. And so what that means is, other than in spending that entire 4 to 6 week period just in clinics with faculty or residents, there's actually a week where you're on inpatient medicine with our family medicine service team, doing admissions and doing the chronic care of patients who are hospitalized. And there's also a week available on our obstetrical team as well, so taking care of pregnant women and newborns. So what does that typically look like? So on our inpatient service, typically that means that medical students show up for the full time that residents are there. So that's usually 7 a.m. to 7 p.m. They participate in sign-out. So depending on comfort level of each medical student, you're given anywhere between 3 to 4 patients that you are really taking ownership for. So you're writing the notes, you're formulating the care plan with the help of the residents and the faculty. You present that patient during rounds. You present that patient at sign-out with any sort of anticipated overnight events. In addition, so medical students are learning not only their note writing skills, their presentation skills, chronic management, acute management. They assist residents in doing admissions and physicals, as well as some discharge planning. And then they participate with the residents in the didactics that happen. And a similar thing happens for obstetrics as well. So they're with the residents from 6 to 6. If patient and resident are comfortable with it, and the medical student's comfortable with it, participate in the delivery, which is highly encouraged. And again, do the presentations and notes and sign-outs. So a lot of hands-on one-to-one learning. When it comes to the educational part for medical students, it really is a collaborative approach. And so as faculty, we get to see all sorts of areas that could potentially be developed, anywhere from the basic skill sets of note writing, presentations, basic medical knowledge, communication skills. So we marry that kind of with what we see, also with what the individual student needs. And so we really encourage our medical students to find their goal for that day, for that encounter, to let it be known so they can really get the tailored feedback that they want and that they need. It's fun because a lot of our residents, anywhere between 1 to 3 years out of medical school, but it still feels so fresh. And so our residents really approach and in fact are enthusiastic about teaching because they were just in those shoes. And sometimes they fight for positions to be able to have that experience with medical students. And again, all of our residents come from all over the country, and so they offer a whole different perspective to medical students as well. Yeah.